Hi there, I'm here to see a patient named Arjun Chaudhary. Hi, Dr. Chaudhary. Yeah, my name's Arjun. I'm here today to get my mRNA vaccine, but I'm not sure what's inside of it or how it works, so could you please tell me? Yeah, sure. For starters, the coronavirus is covered with a structure called the spike protein. And so the focus of the mRNA vaccine is to target this particular spike protein via mRNAs. To remember what the process is like, I like to use an acronym called ERA. This stands for entry, replication, and activation. In the entry phase, in simple terms, the mRNA has to be protected in a package. That's because it's the most valuable aspect when it comes to curing the illness. It's packaged in these structures called lipid nanoparticles, which protect it from degradation from endosomes. Once the package arrives to its destination safely, which is the inside of the cell, the first step is complete. Next, for the replication phase, the body uses an organelle called ribosomes to make the S protein. The mRNA essentially carried the code to make this protein and gave it to the ribosome to produce. Once they make copies of the spike proteins, the copies are then released. This sets off all kinds of alarms in the body. And the last phase is when the body enters the activation phase, which is where the immune system gets recruited to eliminate all the spike protein in your body because it is now recognized as a foreign antigen. So you have your antigen presenting cells like the dendritic cells essentially carrying a wanted poster and presenting it to the sheriffs of the body, also known as the T cells and the lymphocytes. These then get activated and go on to neutralize the antigen or target. All of that's nice, but how did you manage to make these mRNA vaccines so fast? It seems a little suspicious to me. Absolutely not. In fact, mRNA vaccines were being developed in the late 1990s by a Hungarian biochemist named Katalin Karikó. And prior research for vaccines such as Ebola, HIV, SARS, and MERS laid down the framework for the COVID-19 vaccine today. And it was actually due to the courageous public cooperation for volunteers who offered themselves for clinical trials to happen much quicker, allowing us to release the vaccine at a faster rate. So with that being said, do you have any more questions or concerns?